And as board president, I want to welcome all of you for showing up tonight and taking an interest in what we're trying to do. The work is obviously very important. We've obviously got real challenges ahead of us, but it's really important work. And thank you again, all of you, for participating. And I'm going to turn it over immediately to, by the way, a number of board members are here. I appreciate the fact that there are 5 or 6 board members on the attendee list. So thank you especially for joining us. So I'm turning it over now to Nate.
That would be Susan.
Oh, that would be Susan Stearns, our Executive Director. Take it away, Susan. Thank you.
Thanks, Joe. And welcome, everyone. Thank you for joining us on this very cold evening. I hope everyone is home nice and snug. We really appreciate you taking the time to spend an hour with us tonight as we talk a little bit about what's going on in the mental health and suicide prevention world and here at NAMI New Hampshire. And as we look at this, new legislative session, what are our priorities? So, Sam, can you advance the slide, please? So, NAMI New Hampshire is a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. Last year, we served over 50,000 folks, made possible through the tireless efforts of our 65 staff members and our over 200 statewide volunteers. We are incredibly grateful for all of you. So let's do a little level setting as we talk about these issues. Next slide, Sam. So these are probably pretty classic numbers that most of you in the NAMI New Hampshire family are aware of, and that is that indeed 1 in 5 adults and about 17% of youth, so a little less than 1 in 5, experience a mental health condition in any given year. Can we see the next slide, please, Sam? We do know that COVID-19 made a significant impact on the mental health of Americans across the country and across the lifespan. And this data really, I actually find the heading a little misleading, because if you really dig into the data here, this is a study that indicates the impact on adults. This is just adults in terms of their symptoms of anxiety or depressive disorder. The yellow bars are the 2019 data, so pre-COVID. And then obviously we see with the orange bars that spike in April of 2020. And then as we look at the data, it comes down obviously in 2022 and similarly in 2024. But we are still far from that 2019 initial data. So we do see there has been a significant impact on adults and continues to be. Next slide, please, Sam. Here in New Hampshire, we do have data every 2 years from the Youth Risk Behavior Survey, which is critically important information. This helps us, this survey that is given to high school students every 2 years in our state is just critically important to helping to inform us as to what our youth are experiencing. And it also actually helps us leverage funding here in the state, particularly federal funding. So this survey data is just really important to understand how we can meet the needs of our youth, and also in order to ensure that we have able to have the system that we need to meet those needs. So you can see here this data, which shows the YRBS data from 2015 to 2023, where we see indeed significant impact in terms of depression and suicidal behavior for New Hampshire high school students. Let me see the next slide, Sam. It's particularly striking when we break this down by gender, and this is male and female gender, obviously. And you see there a lot of what I think we hear about in the media about girls and their struggles. I always caution people with this data when we see this disparity that one, we obviously want to be paying very close attention and addressing the needs of our girls, but also anyone I think who's raised a boy knows that they may not be as expressive. So as mom of a boy, I no longer a boy, but I often remind myself that we need to check in with our boys. So just as much as we do our girls, and we need to make sure that we're addressing their needs as well. Next slide, please, Sam. And this slide breaks out that data again by sexual orientation. The YRBS, as you can see, doesn't ask more detailed information, for example, around trans students, or did not at this time. But this gives us a sense of some of what we hear about and we read about in other places and across the country, of how that impact for some of our more marginalized youth, that indeed feeling that you don't belong, that there is discrimination towards you or a group you identify with, does have a negative impact on your mental health. Next slide, please, Sam. So here at NAMI New Hampshire, we continue our efforts, as we have for the last 43 years, to try and address these needs in our state through that support, education, and advocacy. We just completed, not quite a year ago, a new strategic plan that went into effect on July 1st. And these are just the high-level strategic plan goals. This is a far more in-depth document that has, supporting actions and goals within it, objectives within it. But in the interest of time, we're just going to talk about these three goals. One of the things I want to say that, NAMI New Hampshire is an organization that is very good about having a strategic plan that really is a living document. And we can say that this plan, which was developed with the help of a consultant at Helms & Company, Patrick Miller, who has worked with us for, I think this was the third strategic plan that he has helped facilitate the process for us. This plan is not something that the NAMI New Hampshire Board of Directors just sat in a meeting and said, let's dream this up. It actually is one that contains feedback from, yes, our Board of Directors, our staff, our volunteers, and then our key stakeholders around the state. Indeed, we had for this plan, I believe, 75 survey responses, and there were another 17 external interviews that went into this, which was a significant increase over the previous strategic plan that was developed in 2021 in terms of that interface. So the goals are slightly different than the last plan, but I think one of the things that we see consistently is this need for NAMI New Hampshire to continue to advocate for systems transformation. We frequently hear from folks about how important it is for us to bring that voice of lived experience to the legislature, to policymakers, to the Department of Health and Human Services, to just make sure that that voice of lived experience is informing our system of care and also is informing our policy decisions. So we're going to talk quite a bit more about the advocacy piece tonight. I will mention that we interestingly had some things that came up in the strategic planning process that were different than the last time. One really, really strident note that we heard was how challenging it is for people to navigate the system and access care. And there were some very strong voices in those surveys asking for NAMI New Hampshire to indeed take on some of that role, which would be outside our wheelhouse in terms of support, education, and advocacy. However, we can certainly advocate for that kind of systems access, and we certainly are. We also recognizing that we have, many underserved populations in our state. For example, older adults, we know are at significant risk of suicide, particularly male older adults, which often gets lost in the conversation around suicide prevention. So we are focusing on making sure that we are addressing needs across the lifespan, looking at our policy work, our support efforts, and our education programs to try and make sure we're addressing all of that. And then the final goal on this slide is making sure that we have that capacity. You know, we hear about workforce a lot, and we're going to talk about workforce, the behavioral health workforce as we go on tonight, policy issues there. But we know that workforce is an issue across industries, and it's no different in the nonprofit sector. And NAMI New Hampshire doesn't build widgets. We offer help and support to people, and we need people to do that. So our staff and volunteers are critical to our being able to fulfill our mission. So we really recognize the fact that we need to make sure that we are investing and making sure that we have that foundation for our organization in order to be able to meet these goals. Next slide, please, Sam. And now it's my pleasure to turn things over to Dr. Nate Jones. Dr. Jones is a member of our board of directors, and he is also the chair of our public policy committee. Nate?
Good evening. Thank you, Susan. I appreciate it. And yeah, so this is it's always great to get to come and talk about NAMI and talk about the public policy efforts. NAMI does some really amazing work, and I've had the pleasure of joining the committee last year and then step into the chair role for this year, and to see the incredible breadth of work that is done by NAMI within public policy. I mean, within everything, but for us, particularly within public policy this evening, this always impresses me every time we have a meeting. And we'll get to meetings in a bit, but one point I want to make too is if this excites you and you get some energy, that's awesome, and come and join us because our meetings are open. We're gonna talk about that in a minute, but it's an open committee. And both Sam and Holly, who are here tonight, do the lion's share of the work and are really great to see in action. So anyway, so we have a public policy platform that guides our work. And this is something that, again, was developed through discussion, through energy, and has been evolved over time. As the slide notes, it was most recently revised back in 2023. It has, I think, 17 priorities in it, so it's fairly extensive. Each of them kind of has the title there and that paragraph, as you can see on the slide. And they range from these pieces that have been, are sort of long-standing goals around things like, the integrating of mental health care and using evidence-based care in community settings, through some things that are certainly more topical at the point. There's a whole piece here about responding to the COVID-19 pandemic. So we really touch a lot of aspects. And if you've never read the policy platform and you're interested in this piece, I do encourage you to dive into it, because I think it shows the kinds of places where a group like NAMI, and I know there's folks here from lots of other groups in New Hampshire, where we can put our efforts and put our time and put our energy. And that's really how we use this. Is this where we put our resources? I think maybe there's the link there that someone has popped into the chat for us. And it basically guides that, the who, the where, the when, in terms of our resources, and like Susan said, how we can bring to the advocacy that voice of lived experience that NAMI can do so well. And so I think it gives us that opportunity. And I think if you have questions on this piece, have questions on public policy, certainly you can ask us of them, a little bit of us tonight. We have some opportunities to respond to some questions. But again, I encourage you to come to meetings. So I think in terms of my time management, if we pop to the next slide, I can go through that a little bit as well. And so the meetings, they are the second Monday every month from 3:30 to 5. They're on Zoom. And again, coordinated largely by Holly and Sam. I get to be there and try to help keep the show running, but really it's a pretty well-oiled machine, I have to say. And again, it's a group that has a bunch of NAMI board members, NAMI volunteers, NAMI staff, but then also other leaders and stakeholders from around the state, folks with lived experience, folks who are we have some legislators who will come to the committee meeting. We have executive directors and high-level leaders in various organizations in the state come to the meeting. And then we have folks who just want to come and be part of the conversation. So it's always rich. It's always interesting. We start out with just some NAMI overview information stuff Susan provides us with, our updates that we always need to know what's going on. Then we go through a set of priorities that we work on, things like the 988 rollout, the emergency room boarding, pieces with Mission Zero, other areas where we're working restoration of competency, the state budget. It's a budget season, so we get to talk about budget, which is always fun and exciting. And of course, a lot of LGBTQ plus effort and work that we're putting in there. And then we, especially right now here in January, and then that in February, the bills have all started to be filed. We're starting to see language, and we're starting to see where we want to put our efforts, what hearings should be attended, where we need to put out calls for action, where we want to support. Fortunately, there are still lots of things to support. And I'm pretty sure the Holly and Sam are going to run through those next, if I'm knowing the agenda correctly. And so we get to hear a little about some of the bills that we're excited about, and also some of the bills probably that we're concerned about. And then we often have a topical piece. So it's interesting. We'll have little presentations on things. So it's a fun time. If you want to get involved, I think you email Holly. I'm assuming if Holly knows, it's probably the best way to go is to get the Zoom link and come be part of our conversation. So thank you very much. And I think now I turn it probably back over to Susan or maybe to Holly.
I think it's Susan and Holly. So
All right.
Sam, do you want to pop the email address for folks who might be interested in signing up for public policy in the chat when you have a chance? And I'm really pleased to have join us here tonight, our Director of Public Policy, Holly Stevens. Holly.
Thank you, Susan. And as Nate touched on, there are many legislative priorities that we have this year, and we kind of categorize them based on where we think they fit best. And some of the categories that we're looking at this session are access to care, suicide prevention, youth and young adults, justice involvement and competency restoration, workforce, and housing and homelessness. Housing and homelessness is one that came up for us last year, and also we heard loud and clear going into this year that it was something that NAMI New Hampshire really had to step up and start getting involved in, because a lot of folks who are unhoused do have a mental illness, and we know that being unhoused can affect your mental health, and that if you are unhoused, you're more likely to have a mental illness. So they kind of go hand in hand, and they're a little bit connected. So we've also started following bills around that as well this session. I think next slide, Sam.
So when we talk about access to care, an issue that I think everyone, I'm sure, on this meeting tonight is aware of, and one that NAMI New Hampshire has been working on for over a decade, is the issue of emergency department boarding in our state. We have indeed seen times when those numbers were very high. We, at one point, I believe it was Valentine's Day of 2021, we had 51 children boarding in our emergency departments. This slide here, though, is really just comparing data from last December, 2024, to data from December of 2023. So I want to be clear, the blue is 2023, the orange is 2024. And folks may see that this is parsed out perhaps a little differently than you have seen us historically parse it out. And the reason for that is it's good news. There is real work happening, and there's actually real progress being made, which means that we have to be more nuanced as we talk about this. So the first set of bars are the entire number of adults. The far right set of bars are children. But then when we break down the adults, we have those adults who are, where it says waiting in emergency departments, who are subject to an involuntary emergency admission. That right now is a place that we are seeing significant progress in our state, thanks to a lot of collaborative work that is happening. When you look, for example, though, at adults who are waiting in a corrections facility, who need that level of inpatient care, those numbers seem to be pretty stable. We do see an improvement when we look at folks with other legal statuses. Those are frequently folks, for example, who are subject or out on a conditional discharge, and that is being revoked. And so that's why that is parsed out differently. They are not subject to an IEA petition. That process has already happened. They are on the other side of that. And then obviously the children, it's very rare that children are IEA'd. So we typically do not see that gets separated out. So we do see indeed some improvement with the kiddos, which we are really hopeful that we will continue to see as things move forward. We know that this problem of emergency department boarding has indeed, as I said, it's been going on for well over a decade in our state. It is how it came to be is a long story, But we know that there are some issues right now that are part of our policy work that are really impacting it and really making it challenging for us to get to that place where indeed no one ever has to wait for this level of care. And that is workforce. As I mentioned earlier, we know that workforce shortages make it challenging in order for hospitals and designated receiving facilities sometimes to have all their beds filled. And then we know access to housing, appropriate, affordable housing for folks often can get people stuck in terms of discharge, which then obviously takes those beds offline. We know that frequently New Hampshire Hospital is reporting upwards of 50 folks who are stuck at that back door, so to speak, ready for discharge, but don't have an appropriate place with the right set of supports that they need in the community. Next slide, Sam. So one of the things that is helping, as I said, we are seeing those numbers come down, particularly those adults subject to an IEA petition. And the Mission Zero initiative is frankly probably the reason that we're seeing that change, that progression. And I want to be really clear that while we are seeing progress, we are very committed to this practice of emergency department boarding. Our goal is indeed it ends. That is NAMI New Hampshire's goal. And it's hard when we talk about progress, yet we know there are people who are waiting right now. So I do want to acknowledge those folks and those families who are facing that struggle as we talk about this, and also though offer up that we are in a really hopeful place in a way that we have not been prior to a year ago in this taking off. So Mission Zero is this collaborative effort to bring emergency department boarding to an end in our state. It is at this time focused only on those adults subject to an IEA petition, but the entire committee, which includes the Department of Health and Human Services leadership, New Hampshire Hospital leadership, our hospital association leadership from several other hospitals, our community mental health centers. This is truly a collaborative effort. Everyone there is committed to this work and to indeed expanding it eventually to include everyone, especially those kiddos. Right now, Mission Zero is focused on these front door issues, which is really making sure we have a system in place. For example, community-based crisis stabilization, a more robust mental health system that would be the certified community behavioral health clinic model, so that we can help prevent people from needing to have that level of care, that inpatient level of care. And then there's also that, how do we get people where they need to go? Make sure we have enough of those inpatient beds. And we have seen New Hampshire Hospital has completed their renovations. All 185 of their beds are back online, which is wonderful news. Dartmouth is going to be adding 5 new designated receiving facility beds. And we know that the conditions of the merger between Catholic Medical Center and HCA require that there will be another 10 designated receiving facility beds brought online in our state. So we have seen increases in that supply. What we have also seen, though, is just an incredible transformation in those coordinating efforts through something called care traffic control. And that is really where all the hospitals work with New Hampshire Hospital on a daily basis in order to try and make sure that folks are able to get as quickly as possible into the right facility for them. And we are seeing significant improvements through care traffic control, so much so that indeed New Hampshire Hospital and the Department of Health and Human Services are starting up a similar group to really look at those backdoor issues, which I talked about previously, but become a huge stumbling block for us, and really speak to why it isn't about let's just build more hospitals. It's about let's fix our system so that people can get the care they need when and where they need it in the least restrictive setting possible. So one of the key things in terms of those backdoor issues has been something called landlord incentives, which has helped landlords take some of these patients as tenants and given them some security so these folks can remain stably housed. That program is underway and has indeed shown some success, and we will need to continue to grow that, obviously. So we are seeing real changes indeed. Sam, next slide. We saw on December 6th, for the first time in nearly 5 years, we had 0 adults who were subject to that IEA petition boarding in our emergency departments. I think that's something that we all, as much as it's a really challenging thing because we know that it hasn't eradicated the issue, but I think it's important that we take a moment and recognize that through a lot of effort, we have accomplished something that we have not seen in many years. And indeed, we had another 3 days at the end of December where we had 0 adults boarding. So in total, we had 4 days in December where there were no adults subject to an IEA petition boarding, which tells me we can do hard things and that we have to work together if we're going to actually create this kind of change. So to all those who have shared their stories, and which I know are painful, deeply personal stories, thank you. It's because of you that we have gotten this far, and we're going to continue this work. We are committed to it. And we know that we are not alone here at NAMI New Hampshire. This is something that our partners are committed to, and that we are truly finding tremendously hopeful. With that, I'll turn it over to Holly.
So we know that when individuals with a mental illness receive the right services at the right place at the right time, fewer folks end up unhoused, hospitalized, or incarcerated. You know, Susan spoke a lot about Mission Zero, that work continues. And we also know that the budget process is going to be critically important going forward in order to sustain the work that's been done on Mission Zero and to continue it going forward. Next slide, Sam. So some of the specific bills that we are following under our access to care category are House Bill 1 and House Bill 2. That's known as the state budget and trailer bill. House Bill 1 is the state budget itself. House Bill 2 is the trailer bill, which is the language or the policy that makes the numbers work. These 2 bills will be extremely important when it comes to access to care. It's in the state budget where the government decides what programs the state's money will pay for and support. And it's critically important for folks to show up at budget hearings and let our elected officials know how important it will be for them to fund programs related to mental health, substance use, and suicide prevention and postvention. So we're hoping that all of you will come out to the budget hearing this year. You can contact myself or Sam if you'd like to do that, and we can get you plugged in and walk you through what that will be like if you'd like to get involved. House Bill 72 will extend the Telehealth Commission. That is a commission that I had a seat on. I hope I still will have a seat on going forward. A lot of the data that the Telehealth Commission reviewed showed that mental health providers use telehealth in about half of their appointments. And they found that 80 to 90% of all telehealth claims filed were for mental health or substance use. So we know that using telehealth is critically important to folks with mental health and substance use disorders. So we want to make sure that this commission is extended to continue the great work that it has done so far. And then not all of the bills have been released yet. And one of the things that we found out is that the Office of Legislative Services has a lot of new employees that are brand new to drafting legislation. So a lot of the legislation that is normally out by this point in time is not out. So there are some bills that I'm going to be looking at tonight that say LSR and a number after that. That's a legislative service request, and that's just where the title of the bill is filed. So sometimes we don't know what the bill actually says. So I just wanted to preface my review of all of the bills by saying that. LSR 0999 is one that we actually have language for, that Sam and I have reviewed because we helped work on the language of this bill. And it would establish and develop a crisis stabilization services trust fund. And also a telecoms fee on all phone lines in the state to provide for stable, ongoing funding for crisis services, including what they call the 3 pillars of someone to call, our crisis call centers, someone to respond, our mobile crisis teams, and somewhere to go, which are the 23-hour observation crisis units that we have 2 of in the state. Next. Thank you, Sam. And then our next category is suicide prevention. We know that for young Granite Staters, ages 10 to 14, suicide is the leading cause of death. And for those ages 15 to 34 is the second leading cause of death. And it's the third leading cause of death for those aged 35 to 44. And we also know, Susan mentioned, older adults. We noticed that in last year's CDC statistics that were released, for older adults, suicide has now crept in to be the 10th leading cause of death for those folks. So some of the bills that we're following this year, can you advance the slides? Thank you, Sam. Is House Bill 56. This bill would impose a waiting period of 72 hours on all firearms transfers, which would include sales. We know that putting time between a decision to end one's life and acquiring the means to follow through with that plan, that we can save lives. So if we're able to put a 72-hour waiting period on all firearms transfers, we may save lives. House Bill 148 would roll back some of the anti-discriminatory protections for transgender individuals regarding bathrooms, locker rooms, women's sports, correctional facilities, and mental health facilities. And I just want to make note that there's nothing intrinsic about anybody in the LGBTQ community that makes them predisposed to have higher rates of suicide. What we know is that it's the discrimination and the stigma that they face that causes the increased rates of thoughts of suicide and them taking their lives. And so House Bill 148 would roll back the protections that Governor Sununu put into place a few years ago. And we know that this would put our LGBTQ folks in danger just having conversations about these bills, because they know that they are being talked about and they're being discriminated against by the mere fact that the legislature is considering these bills. House Bill 159 is a bill that would require a national criminal background check to, let me start that again. It's a national criminal background check bill that failed last year. It's the NICS bill that NAMI New Hampshire had cautious support for. It would require the state to report involuntary psychiatric admissions to the NICS list. We're cautiously supportive of this bill because, and we're closely monitoring it to ensure that the protections that we recommended last year remain in that bill. And we've seen the draft of this year, and it does appear that those protections are in it. And those protections that we were really concerned about were that the report to the NICS system be made by law enforcement or the judicial branch, and it not be a provider that be ordered to make that report, so that we could protect the therapeutic relationship of the patient and the therapist. That we also wanted to make sure that there was a process by which the person could petition the court for relief to have their rights restored. And we wanted to make sure that any removal of firearms would be done in a way that limited engagement between the individual and law enforcement to avoid dangerous confrontations. So we're going to be cautiously supporting that bill. Again, making sure that it has these protections in place and that those are not dropped out through amendment during the legislative process. And then there is Senate Bill 38. It has a different title than House Bill 148, but essentially does the same thing. Those two bills would roll back those protections that I talked about. Next bill, next slide, Sam. Thank you. For youth and young adults, Susan talked about the YRBS survey that the youth do every 2 years. And in this past the past time that it was done, nearly 40% of students reported feeling sad or hopeless, and approximately 21% of those students seriously considered attempting suicide. We know from the Trevor Project that 39% of LGBTQ young people seriously considered suicide in the past year, and 90% of them said that their well-being was negatively impacted due to recent politics. And this includes, as I said, you know, the mere consideration of discriminatory bills that are aimed at taking their rights away. More than half of transgender and non-binary young people found their school to be gender affirming, and those who did reported lower rates of attempting suicide. So we know that if the school is affirming and has affirming spaces, that there will be lower rates of suicide in this population. And so to address these statistics, NAMI New Hampshire has been involved and will continue to be involved in maintaining funding for youth mental health services, as well as any legislation that would help protect and promote affirming spaces and environments for all youth. Next slide, please, Sam. So some of the bills that we're looking at in this category are House Bill 377 that would allow providers in New Hampshire would not allow providers in New Hampshire to administer, prescribe, or refer for hormone treatments or and puberty blockers for minors, and would make these a Class B felony. Another bill that we are following is a bill that would require schools and treatment facilities to report incidents of seclusion and restraint of children to the Office of the Child Advocate, and it would allow the Office of the Child Advocate to provide oversight authority for that purpose. Currently, the Office of the Child Advocate does not have authority to review seclusion and restraint that are done in schools. And then we know of another bill that we don't even have the LSR number for this one at this point. It would create a public-private partnership to fund youth mental health services. And so what that would do is assess a fee to the commercial insurers for every eligible life covered. And in this instance, what that would mean would be every child covered, since it's aimed at youth services. And this would cover services such as the Fast Forward program, which NAMI New Hampshire provides family peer support for. Fast Forward stands for Families and Systems Together, and it's a wraparound model of care for children who are in crisis. Currently, providers can bill Medicaid for the bundled wraparound services, but if they bill a commercial insurer, the commercial insurer just won't pay because they don't have contracts set up, and they have not been willing to this point to engage with the entities providing those services to engage in talks about contracting with them. So this would ensure that all third-party payers are contributing to the cost of these services that are currently only being paid for by Medicaid and the state. Next slide. Thank you, Sam. Another category that we are working on is justice involvement and competency restoration. About 2 in 5 adults in jail or prison have a history of mental illness, which is higher than what you find in the general population. In New Hampshire, we have no formal system of competency restoration. And in 2019, only about 44% of individuals were found to have their competency restored. This is opposed to 80 to 90% of other states that do have competency restoration programs. So we are an outlier when it comes to restoring competency. In order to ensure that folks are connected with appropriate treatment, New Hampshire must invest and expand in a competency restoration system. And one of the bills that I will talk about in a minute would further improve the efficiency of the competency evaluation process if it were allowed to allow for the dismissal of certain violation and Class B misdemeanor crimes to be dismissed at the court's discretion. Next slide. Thank you. We have two bills that we're looking at for competency restoration. These are two bills that NAMI New Hampshire sought sponsorship for, and were able to receive find sponsors that were willing to bring these bills forward for us. House Bill 480 would instruct the Department of Health and Human Services to create a pilot program where a new position called a forensic liaison would be created. That person would become involved when a defendant in a criminal case raises the issue of being competent to stand trial. The forensic liaison would act as an intensive case manager to assist in getting the person to the initial competency evaluation. And then if they were found not competent but restorable, would assist the person in obtaining services to restore competency. And then there is Senate Bill 48, and this is the one that was mentioned on the previous slide. This bill would allow the court to dismiss certain charges when competency is raised in a criminal trial. It would only allow for violation level and certain low-level misdemeanors. Those are mainly non-violent misdemeanors to be dismissed at the court's discretion, taking into consideration the defendant, the alleged victim, and the community. These two bills are really dense bills that I could talk for a full hour about in and of themselves, and we don't have a lot of time for that. So if anybody has any questions about what competency restoration is, or what not being competent to stand trial means, please reach out to me or Sam, and we'd be happy to go through these bills with you in more detail. Next slide. Thank you, Sam. The next bills we have are in the workforce. You've heard that the workforce is a challenge right now, not only for New Hampshire, but across the country. We are working on measures that will address the workforce shortages, as well as working on things like I mentioned with the telehealth services that help improve being able to get out-of-state providers to be able to provide services to our folks here in New Hampshire. So there's a lot of work we're doing on the workforce front. We know that we must improve healthcare workforce recruitment and retention in order to help us solve this crisis. Next slide, Sam. So one of the bills that we're working on just still has an LSR number, and we haven't seen the full language for this bill, but we know that it's a bill that would expand access to primary health care and direct care professionals by creating workforce pipelines. It would also increase Medicaid reimbursement rates for providers that take Medicaid to hope get more providers to accept Medicaid and get them into that space. And it would also provide more funding for the state loan repayment program. Since the language of the bill has not been released, we don't know the exact details of that. But one of the things that we have been advocating for are those increased Medicaid reimbursement rates, as well as more funding for the state loan repayment program, and also expanding that to bachelor level individuals who work in the mental health space. And then there is another bill that we don't know a lot about, but we have heard from our partners in the community mental health center space that is a bill that would create an uncompensated care fund that would fund the community mental health centers. So any services that they are not able to receive reimbursement for, such as commercial insurance, will not provide reimbursement for case management. They consider that a social support and not a medical service. So this fund would reimburse the community mental health centers for those services that commercial insurance does not pay for. Also for anybody who receives services from them who does not have any insurance. Next slide, Sam. And then lastly, the bills that we're working on are housing and homelessness. As I mentioned, access to housing can impact one's mental health, and at the same time, you know, one's mental health status can hinder their ability to maintain housing as well. On any given day, there are individuals ready to discharge from New Hampshire Hospital, as you heard Susan say, that can't do so because they don't have a place to go. People with mental illness are overrepresented in the unhoused population. 1 in 5 people experience homelessness have a serious mental illness. This is different than the number that Susan provided earlier of 1 in 5 people in the United States experience a mental health condition. This is 1 in 5 people have a serious mental illness. So we know that we need to invest heavily in robust and varied housing in order to address the housing crisis that we have right now. Next slide, Sam. There are a few bills that we're working on in housing and homelessness. House Bill 60, relative to the termination of tenancy, the expiration of the tenancy or lease term. Under current New Hampshire law, a landlord must have just cause for ending a tenancy, even if it's at the end of the natural end of a lease term. This bill would get rid of that protection and allow a landlord to end a tenancy for any reason or no reason at all, and it could lead to discrimination against people with a mental illness or folks who are in the older community. House Bill 348 would allow municipalities to require a person to have 90 days of established residency in order to receive local general assistance, and would it would allow these municipalities to require folks to have a lease, a car registration, or a utility bill to prove residency. Many folks being discharged from psychiatric inpatient facilities, such as New Hampshire Hospital or other designated receiving facilities, or individuals being released from lengthy incarcerations, would not be able to avail themselves of local general assistance of any city or town that has established these requirements, because they would have no way of proving that 90-day residency. So we know that these folks that are waiting to get out of New Hampshire Hospital and other folks in designated receiving facilities, a lot of them did not make a decision about which hospital to go to. And they may have ended up at a hospital far away from where they lived originally. And so when they're discharged, and they likely have left, when they've left their housing, if they were inpatient for any length of time, they may have lost their housing. So this bill would allow the municipalities to require this, which is not in current law. Current law says they have to serve anybody who walks through their door, and it would be a huge barrier to folks receiving medication, food, and housing assistance. House Bill 519 is a bill that Waypoint had requested go forward. They have stated that without increased funding, they will no longer be able to operate their youth and young adult shelter in Manchester. We know that many unhoused young people are struggling with mental health issues, and this shelter is one place they can turn. It's a safety net for young people in the greater Manchester area. It serves a wide breadth around Manchester. And so we know that this is a very important bill for unhoused young folks. And then LSR 1096. We haven't seen the language for this bill just yet, but it would provide funding for the community mental health centers to create more community and transitional housing. And we know that this is something that is lacking across our state. As Susan mentioned, with the Mission Zero plan earlier, having these housing options is critically important. And I just want to reiterate that we have been told that up to 50 people a day are waiting at New Hampshire Hospital for discharge, but have no place to go. And if we're able to help get these folks out the back door into supported housing, there would be less people waiting in the emergency room for beds. And so this is how you can get involved. This is what our Take Action page looks like. And you can go to this page, you can see what bills we're following. You can sign up to receive our public policy alerts that we send out weekly to let folks know what's going on in the week up ahead, coming up ahead, for bills that they can get involved in. You can also see any testimony that we've written in the last few years. And it also gives instructions for how you can register your opinion on bills online if you're not able to go in person, how to submit written testimony, or just register your opinion, whether you're in favor or opposed to a bill. Next slide. This is what one of our public policy alerts looks like. And it shows you what the public hearing, what the bill is, where the public hearing is, and how to register your opinion. And it also gives you a little description of what the bill would do and whether NAMI New Hampshire is in support of the bill or whether we oppose the bill. And your voice matters. This is a picture I love. It's a 15-year-old from Merrimack who last session requested a bill go forward. It was a bill that we supported, having the eating disorder helpline put on the backs of student ID cards. And he followed that bill all the way through, and it was signed by the governor last summer. So now if you have a student in middle or high school in might just be high school. I think it's just high school. If you have a student who's in high school in New Hampshire, if you look at the back of their ID card, you should see the eating disorder helpline now. And he was 14 when he started this endeavor, 15 when the bill was signed into law. So we always say, if Matthew can do it, so can you. It's easy to get involved. It's easy to reach out to your legislator. They always say, you know, they don't receive enough phone calls from their constituents. So if you'd like to get more information about how to reach out to your legislators, you can reach out to us and we can get you that information. We're also happy to even help walk you through what a call would look like with one of your legislators if you're a little bit anxious about making that initial phone call.
So we won't go through all of these items on this list, but I do want to just point out that these are actions that any of us can take in order to try and move forward this work around mental health and suicide prevention and substance misuse disorders in our state. We all have a role to play, and we've had a couple of folks who've emailed us while we've been here tonight saying asking how they can get involved or wanting to join the Public Policy Committee. So thank you. Please continue to reach out. One of the things that I really want to point out on here is making sure that you care for each other. We've talked a lot about how we want to advocate, but remember, folks, it's really important to look out for each other. Give the next slide, Sam. And I do want to give a big shout out to all of our volunteers who do that so well every day. So thank you all. I know a lot of you are on here tonight. The next slide, Sam. So please save these dates. Our annual conference is coming up. The registration link will be out very soon. Save the dates. We have a keynote the evening of Tuesday, March 25th, and then followed by a day of virtual workshops on March 26th. And then we can go to the next slide, Sam. In addition, I want to point out that This Is My Brave returns this May, and that we still have some slots open for auditions. So please, if you are interested in sharing your story on the big stage, please check out the link and sign up to audition. We would love to have you join the show. And then wanted to point out that we have a number of resources that are available on our website, and we have a lot of materials that we'd be happy to share with you. Please don't hesitate to check out those resources or ask us for materials at any time. We've included on the next slide crisis resources. So it's so important that everyone recognizes that help is available 24/7. So please don't hesitate to use those. The next slide talks about how you can promote resiliency and self-care, and then we have some of ways to get in touch with us on the final slide. Do we have any questions, Sam? Because I realize we are almost out of time.
Yes, we are almost out of time, but we have just a few questions, and if anyone has any last-minute questions, please feel free to drop those in the Q&A. Touched on this a little bit, but one question asking what opportunities there are to volunteer with NAMI New Hampshire.
Well, we have a lot of opportunities for folks to volunteer with us. As we've talked about tonight, you can sign up and join our public policy committee. You can come out and testify. We're happy to help you do that. And you can take an advocacy training when they come around again in the fall. But we have a lot of roles. We have folks, if advocacy and doing that piece isn't what appeals to you, we have volunteers who teach our education programs. You can be trained to become a support group facilitator. We have our speakers programs where people are trained to share their stories and do that usually in very public settings. So that's if you have a real desire to really go out, share your story, and change hearts and minds, then please reach out to us. We have opportunities for folks to go to various events in communities and represent NAMI New Hampshire by being there at a table and helping people find the resources they need. So there are a host of ways that you can volunteer with us. Please reach out to us at naminh.org/volunteer, or you can email us and we'd be happy to help you with more to find the one that fits you.
There is a question regarding availability of transportation for people to get involved if they aren't able to drive. For that, I would say reach out to us personally. We will be happy to explore possibilities dependent on the case. One more or two more quick questions. So in light of the legislation affecting LGBTQ+ youth, what are some good ways we can protect and support the mental health of those directly impacted by these bills?
So I think it's really important that we continue to be affirming in our messaging, and that we remind people that they're not alone, and that while sometimes some of the rhetoric particularly is disturbing and can be really painful, that there are a lot of really, really good people who are doing this work. And indeed, this is your home. New Hampshire is your home and you belong here. So we want to continue to make sure that we are sharing those messages and reminding folks they're not alone.
And then our final question that we have that I thought was nice, maybe get a short answer from each panelist, is what is giving you hope right now?
So I'm going to go because then someone's going to steal it from me, but it really gives me a lot of hope to be on here tonight with all of you. And as we've talked about our work tonight, working collaboratively across the state, it was a really good reminder for me that as much as sometimes things can seem challenging, we are in really good company as we do this work. There are a lot of people who really care a lot about it, and that gives me tremendous hope.
Yeah, I'll jump on Susan's bandwagon and say, not only everybody on this call, but everybody that, Sam and I sit around tables with that are doing this work with us. We have a lot of partners that are in this space that do this work with us every day. And we have a lot of bipartisan bills that are going to do a lot of good things. So despite the challenges I think we're going to face, we've got a lot of things to look forward to as well.
What gives me hope is the realization, the recognition, and the memory that the pendulum swings, and that things change over time, And when you look through the history of the 20th century, for example, there were extremely low points. And then there were also some really strong high points. And our generation, my generation, people, boomers like me, we really have a sense of right and wrong, and I think we act on that. So I'm beginning to feel as though some of the older folks in the legislature may be receptive to some persuasion.
And for me, I work in schools. I'm a psychologist, and I think I find hope in the fact that there's always new young professionals joining the field. And while, of course, every field would love to have more folks joining our field, there are always new people coming in every year. And we always see new folks coming and wanting to just do the work and work for us, work with kids. But and it is true with our field as well. I mean, sure, there's workforce shortages and we need to work at workforce. We always do. But there's still a whole lot of people out there trying to make the world a better place. And then we see them every day. And that's why I think, to me, that gives me hope, because they have hope.
Thank you all. That's very inspiring, and I appreciate the answers to the questions. And I'll toss it to Susan to close us out for the night.
Thanks, Sam. I appreciate that. Did you want to tell us what's giving you hope?
Mine isn't quite as moving as everyone else's, but it's always my dog. Seeing him so excited to get up every morning.
Well, we're always happy here at NAMI New Hampshire to hear about everyone's dogs. So I want to thank everyone for joining us tonight. Please, if you will get a link to this recording, as well as a link to all the resources that have been discussed, that'll be sent out to you at the email you registered with. So stay tuned, and that will be coming your way in the next few days. We are incredibly grateful to be able to partner with all of you in our collective work to improve the lives of Granite Staters affected by mental illness and suicide. You remind us every day that truly hope starts with you. Thank you. Be safe, stay warm, take good care.